Today's testimony was all favorable for the governor's plan to buy Crown land in Barrigada for the complex. A trio of administration officials were there to counter prior testimony from doctors who favor Ipoh Point as the new site. Public Health Director Art San Augustine says his department's 21 program offices are scattered around 11 different locations and would benefit from consolidation at the complex.
I know that there are two physicians and they talked about public health and that we perhaps are not best suited to that medical complex. And I take exception to that simply for this. Over 20 years, public health and social services, and to this day, does not have its official site. So really, it's imperative that we invest not just in the medical complex of GMHA, but also for public health and social services. When you go back and you look at a holistic perspective of care, it's not just the medical component that is critical.
Meanwhile, Veterans Affairs Director Joe San Augustine rebutted the notion that a veterans clinic can't be built here. He says multiple efforts are underway to gain federal support, and he's just back from a conference of National State Directors of Veterans Affairs.
And I went to that conference to fight for a better health system and better care for our veterans here on Guam. And the problem we have is we give up so easily. Why do we have to send our people off island for medical care? And mind you, I'll say this. There are 3 other states in the State of Directors Conference that fought for Guam, that went up there and said, build a complex, build a larger facility for the people of Guam, because they fought like we did. So for someone to say this cannot be done, it could be done, and we're going to fight to get it done.
And there was Hospital Administrator Lillian Posadas, who says a central site is especially better for long-suffering residents of the South.
It is most advantageous and beneficial location for the residents of Guam. Having the other healthcare facilities such as DPHS and Guam Behavioral Health co-located in one medical complex will improve the continuity and follow-up care. A statement made on Wednesday's hearing that there is no history of interactions between public health and the hospital, that is absolutely untrue.
And the deliberations over the new hospital might not be over yet. Oversight Committee Chair Therese Terlahi will be seeking yet another date to flesh the issues out even further. Nestor Lecanto, KOAM News.